we have a doctor in our group, as in on, we have an interview today, and we are going to interview Dr. Mahdi Al-Dayyeni. I apologize because the name is little difficult for me. I've misspoken it. I apologize for that. Um, but then, yes. So he is a surgery resident in vascular surgery. He has been here since 2015 or 16. It is
15.
15. And today we are going to learn from him his pathway, what he did, how he did it, and how he has uh, arrived or have achieved what he has achieved so far. All right. So I will just move forward with the queries and the questions, and I would request Dr. Mehdi to, in short, like introduce himself again, like tell us where he comes from and when has he completed his graduation, what, how it has all happened, and most importantly, what we would also like to know is why Germany.
Wow, thank you. Thanks a lot. I'm really thankful that I'm here, and thank you for your work. You've done wonderful work. Yeah, thank you. Thanks a lot. My name is Mahdi. Like it said, I come from Iraq. I studied medicine there. I finished my studies 2012, and I worked like two and a half years in Iraq. And my dream was always to be a surgeon, and I wanted to be a surgeon in a better country, in a country where medicine is like a lot better than the medicine that I saw in Iraq. And that's why I came 2015 to Germany. I chose Germany because in Germany you have my dream was at that time was to be heart surgeon
Okay.
and cardiac surgeon. And for cardiac surgery, I saw like two or three options, like in the United States or UK or Australia. And Germany came late 2015, and I had a friend here who was also a heart surgeon, and after like 2 years, he was working in heart surgery, and I saw that it's possible in Germany, and that's why I chose Germany. Good country, one of the best in Europe, and you get paid good, and you get to be a surgeon. I got to be my dream. That was what's important for me, and that's why I came 2015.
All right. That means that even the hardcore specialties, like when people from, for example, India or Pakistan or Bangladesh, they think about going for residency abroad. The question is that, do you want to get into surgery? If the question answer is yes, then they say that, okay, don't try for USMLE because that's not going to work out. So
So,
yes, that is what
right.
you mean, that if you intend to go into such high-end branches, radiology, or I mean dermatology, those are still higher. I would say that here also people have difficulty getting in, but surgical branches, vascular surgery, and all can be done. Like that is what you say. In in Germany, it
It,
can be done, right?
it it's not like very easy, but
Hmm.
it's very possible.
True, true, true. All right. Did you have to take exams as well?
Yes, I had to do the exam. So first you have to do it like the general German language to a high level of B2. That's like the fourth level out of six levels. And this exam I did like after 6 months of arriving in Germany. And then I did the test for the medical language. There are two types of tests. There are the Fachsprachprüfung and there's the Telk test. So where I lived in Hessen, there are like 16 states in Germany, and some states have other tests. And where I lived, you had to do this Telk test. I did it like after 1 year of coming to Germany, and then I applied for the license test, the approbation test, and I did that like after 2 years of arriving in Germany.
Years it has taken. So, all right. That means include the language, the test, and everything. After 2 years, after your approbation, you could begin your residency, right? So it was the duration of 2 years.
Yes.
All right.
You
And
get you get to work. I got to work. I got like my first job after 1 year in Germany, but this time where you don't have a license, you have like a temporary license. This is no only made to work so that you get to work and learn the language while you're waiting for the license test. And I got a job and I got to work, and yes, but that doesn't count
As training.
as training time. But your training, you get to earn money, you learn the language. I think it was like what was for me. It was for me like 16 months, I think. I don't see it as a loss. I learned a lot.
Wonderful, wonderful. All right. So, okay, uh, what everybody wants to know, like our audience who are in foreign countries and want to work in Germany as a doctor or medical professional, dentists, physiotherapists, and all. So, everybody wants to know how is work in Germany? How is the training in Germany? So, can you give us a fortile or noctile? So, as for doctors, I mean, other branches will talk with somebody else, but you are a surgeon in training, and for you, what do you see as the pros and what do you see as the cons? Like, what are the problems and what are the good things about training in Germany?
So the good things. So when I talk about good things, I compare like Germany. I can't compare Germany to other countries because I've never been there. But I compare like Germany to my country where I came and where I learned and where I worked.
Yeah.
And maybe you can like hear the story from other people who've been otherwhere, and you can like make your own idea. But I think the first like thing that is for Germany is that in most hospitals you have a very good medicine,
Mm.
and you have like everything you want in most hospitals. It's not in every hospital, but in the most hospitals. What does that mean? That means like where I came from, like CT, computer tomography was like something. Yeah, we didn't do that like
Mhm.
very often. Just like last night, I did in 2 hours 4, because it's there. You do it,
Yeah. Yeah.
or MRI, or everything. You can do everything here. That's
Mm.
like one thing. One another pro is that you don't only work. We work a lot, but I find that people like maybe in India and in Iraq differently, they work a lot more than we work here.
Yeah. True.
Like we get here 30 days of urlaub.
Yeah. Yeah.
What
Vacation.
do you call it? Like
Paid
vacation,
vacation.
paid vacation, 30 days of paid vacation in year. I find it really great. And then where I work, we do only one weekend.
Hmm.
Like from 8 days, you do 2 days. Every 2 or 3 months, I do like 2 weekends, and I do like four. And when you work on weekends, you get paid a lot more when you work on the normal days. It's not like you working for free. That's what like happens in other countries. You don't work here for free. Your
Yeah.
time is really valued. You get paid for your time, and that's a really big pro I find. And about the time, I think that's the most important thing really, because here when you have this time, you can use this time for learning. You can use this time for getting better. You can use this time for being with your family. You can use this time for your hobby. It's you have time. And in other countries, maybe you have money. I don't know. In Iraq, you can have money as a doctor, but you don't have time. You never have time.
True, true, true. Here, see,
Yeah.
here I would say to this point, which I always feel is that here your time is valued as in for every stunde, for every hour you get paid. And it is not like, for example, in US, you work 80 hours per week and that is your job, like that is your normal job. In India, you don't have any time schedule. You go to hospital as a resident, you live there, you work there, and then after 3 years, someday you realize that, okay, now my training is finished and then you see the world outside how it is outside.
I
So
can relate.
but yes, and but there is a benefit to that as well, that when you are
Yes.
totally dedicated there, that means you do not have a social life, you do not have any like what you say, any personal life, but that is for duration of short time and then you can train. Here the problem is that there's a foretell and noctell. I mean, this is supposed to be an interview, but I'm just sharing my idea on
Yes,
the
yes,
point that
please.
okay, if they say that okay, you work 8 hours per day, that means you work 8 hours per day, and after that you can go home. And in these 8 hours, if you have not learned anything, you have just done the work that they wanted to do, then fight because they're paid 8 hours. President that okay, as a laborer, I would say, for your time, but then you did not learn anything.
Yes,
So both
that's
perspectives has to be taken into
you're
consideration.
totally right. You can see that like as a con, but I think it's not really a con. It's another system,
Hmm.
and if it's just like iOS and Android. Yeah, it's not like good and bad. It's the matter of things that you
Definitely.
know, and the system that we know, it pushes you to do the things that the system wants. It makes you, in the end of it, a good surgeon. I don't know if everybody becomes a good surgeon in India or in Iraq. That's another thing. But many become good surgeons because they are really trained very good in a small time. But in Germany, that's like another idea. That's a system who concentrates on the person and the people who are better than the others. They will invest more time. They will work more. They will go to courses. They will learn more, and they will get better.
Okay.
They're not gonna wait. And
This
those
is the
people, you see it like everywhere in Germany. Those people are like they are the best. They are chefs. They're getting paid more. They're having really a good life, but it doesn't come like very easy. And nobody will. If you don't care, nobody will care.
exactly the eigen initiative. So your own initiative,
Yes,
that matters here. Nobody's going to tell you to read a book. Nobody's going to tell you to go to a fort building or a
nobody.
CME. They're happy if you draw blood, if you write the notes, and if you
Yes,
see make rounds there, and in the
yes,
in the operation theater, if you're holding retractors, they're happy with that because they're paying
yes,
you less. But then if you're interested, then you have to show that, okay, look, I've
yes,
read this thing. Now, can I do this procedure? Can I do
yes,
part of this step of this? Okay, this
definitely.
wound closure, or wound
Yes,
opening, or anything like that. So yeah, that I totally agree with you on that point. That okay, the eigen initiative, the own initiative matters here a lot. You are not pushed
yes.
to improve yourself.
It's not like they think differently. It's not like I don't know how it's in India, but in Iraq, that's like the people think all in groups. We have here. There is no we have. There is a lot of I have. I
Hmm.
must make myself better if I want to. If you
Yes.
don't want to, nobody will. That was a problem for me, like at the beginning, because I knew that system from Iraq where everybody pushes you. Why didn't you learn? Why didn't you do that? You have to do that. And at the beginning, nobody pushed me. Nobody told me. Nobody asked me. I was
Yeah.
like, yeah, but like after some time, if you really want to deep, the thing is you get to choose where you work. It's not easy to choose where you work. If you like want to work at very good hospitals, there are like so many other people who get the job like easier than you if you come like from another country. But you get to choose, you get to work on yourself, and I know many good doctors who came here and they're working at the best hospitals.
True. True.
It's not impossible.
I will totally agree to that. I mean, the pathway is difficult for beginners,
Hmm.
especially because of the language, because you don't
Yes.
familiar. But then slowly, if you're up to it, then you find a path.
Yes.
So okay, so, then I will want to know from you that okay, as a foreign doctors who are now planning to come here, uh, what would you suggest? What kind of hospitals should they focus on? Should they focus on uni clinics, university hospitals, which we know are the best place of medicine in Germany, or
Hmm.
should they focus on smaller hospital? What should be their strategy?
I think I think the strategy it's like my opinion, and that's how I did it. I think the strategy it's better to start at a small hospital because you have many problems in the beginning. Your problem is not only the language, you have a totally another problem that nobody's talking about, and that's the system. You don't know the system here. You don't know where the people come. You don't know where the people go. You don't know so many stuff that are I don't know, but the system in Iraq where I came from, it's not that developed here in Germany, like here in Germany. Like here is they have this very developed but very complicated system that you need to understand, and it takes like I think it takes a year. But at the time that we came, there were not a lot of help. But
Yes.
I think now, like you have a channel, I have a channel, and we're trying to help the people that are new. Maybe in the coming years it would be easier, but I think you have this problem too. In the beginning, it takes a year or two to understand like everything
Yes, yes. For me, it
in
took a
the
little
system,
longer than a year.
or longer, or
Yeah.
longer. I some things I just understood like last year after 4 years here.
Yeah, so you learn every time you are learning something new, something.
Yeah.
Even now, I have problem. I teach Fachsprachprüfung, and I build courses and all also for Fachsprachprüfung and all. But
Yes.
still, I have problem to find a difference between Überweisung and Einweisung. What do
I, you have to watch my video. I did a video about it.
so I have to remember the okay, Einweisung, okay, where do you go with the to the hospital? Überweisung, you go
Yes.
to the Facharzt or a praxis. So all it does not come automatically. So it is there are many such examples. Just an example. There are many things which one has to think like twice. In your
Yes.
own language, in your own country, it would have come to you naturally,
Yes.
automatically, since you have
Yes.
learned that since childhood. But
you
here,
you learn you learn that in the times where you're studying. That's
yes,
the difference. And
yes,
we didn't study here. That's why we didn't learn it, and we need some time.
yes,
But like for someone who studied here, it took like 6 years. They were always in hospitals, and they saw that, and that takes a little bit of time. That's why I say in small hospitals you get to learn more. The people are like, there is not a lot of stress. There is not a lot of work. There are the people have a little bit more time for you. They're
yes,
like more patient.
okay,
But like in big hospitals, in the hospital where I work now, or where you work, or in like Uniclinicum, in the university hospitals, there is a lot of pressure because they have to work. They have to work a lot. They have to do a lot of patients, and not everyone have time for your questions, for your
yes,
dumb questions in
yes.
the beginning, because you don't know. You don't know. It's
That's your
not dumb,
problem.
but you
You,
don't know
you you don't know that is your problem. That is not their problem. Yes.
that.
And here's
Yeah.
a word of caution for beginners. If they even happen to get a position at big university clinics and all, there's always a risk that the first 6 months are proboscite. Proboscite is
Yes.
probation period. That time, even the doctor working can give a notice that okay, I'm goodbye. I'm not coming from Monday, or
Yes.
you can be told that okay, 2 weeks, please don't come anymore. All right.
Yes.
So yeah, that risk is always there for foreign doctors who have broken
Yeah.
German, who do not understand, who are not well prepared. Yeah, so not prepared for
That
that job.
not only beginners. I saw that happen to one specialist. They throw him out like the last week. The last week
Of
they
the
throw him
residency.
out of
That is
nowhere.
so that I mean that comes as a surprise. But then this I
Yeah.
have seen with that happening with many foreign doctors in the first stellar. They begin in 2 months. They tell them that okay. So I have seen that happen to several people. That is why I always people tell people that okay, be cautious. First 6 months, be nice to everybody. Even
Yes.
you go. Uh, Another thing here. I mean, I would like to share that the culture that we come from. I mean, culture
Yes.
in India is totally different than in Iraq or in Germany, US. In
Yes.
India, what we learned is that we don't go introducing ourselves to everybody. Okay,
Mm.
if somebody wants to know who you are, then they will come and they'll ask you that. Okay, who are you? Okay, yes, yes.
No,
That
no
is
way here in Germany. You
yeah.
have to introduce yourself to everyone.
Yeah, so here in my first stellar, where I was doing hospitation, not the stellar, the hospitation, I was
Yeah.
not aware that I have to, when I go in operation theater, I have to tell hello to everybody that, okay, I'm so and so, and so I'm like, yeah,
Yeah.
why? I mean, they will not even remember. Why should I
Yeah.
like make an effort? But then I was told later on by other colleagues and the senior people that no, I mean,
Yeah.
this is the way you have to do, like, you have to introduce, that is the system here. So these things, and when you don't do that for with many people, then the ice is not broken. Then you are always that
Yes.
foreigner who does
Yes.
not introduce
Yes.
himself.
Yes. And
So
they're not gonna help you if
they're
they
not.
don't know you. If you don't introduce yourself, and yes. Yeah, you're right.
Yeah,
You've got it.
I know. I'm taking. I mean, this is supposed to be interview, but it's the conversation has become so interesting that
I find it wonderful. Your opinions are really
uh,
very very interesting.
okay. So what I would like to know now is that okay, we know that okay, 6 years Weiterbildung, then Fakat's exam. And what is the scope after FACATS for a foreign doctor, okay, who comes here, does his training? Is there a difference between him and the native doctor who has like studied here, he's born here in Germany, has become a FACATS? Between him and the foreign doctor after FACATS, what is the scope? Is there any difference? What should one? What are the ways? Can like I know people can like work, start, keep working at a hospital, have their own practice. So what are the different options?
I think at this point we have to clear one thing, because it was like for me a problem at the beginning. I thought always like the point of Facharzt, the point of what do you call it in English, specialist.
Yeah.
It's not really specialist in Germany. It's really like the first step.
Mm.
And in the surgical branches, you start really after this. You just they teach you like the basics, and it's not like in our countries. In Iraq, at this point, it's just like you said in Indian. You get really intensive learning, and then they let you free. You do whatever you want to. Here, it's not like that. Here, they teach you the basics in this period of training, and then you start looking after that, and then it starts. And what you can like after you have like your Facharzt, you can like stay where you are
Mhm.
and work and get to operate like more because the people know you, or you can go and take it to the next level. The next level, and that's really the interesting level. That's the level that we have in mind of specialists. That is called here in Germany Oberarzt, and there you have really responsibility. You get to, but mostly you don't get offered this job just because you have passed the test. You don't. They test you, like you said. You get a like you maybe look another job in somewhere else, not like where you did your training, and they test you for 6 months. If you can, if you cannot. I saw many people like they just did the exam and then they took like a bigger job, and
Mhm.
they weren't like really ready, and they got fired, and they had to find another job. But the other part of your question was like, are there difference between foreign and German? Um, you'll find people that say there is a difference, but I think that's like my opinion. I think there is not a big difference. It's really about what you can do here in Germany. It's really about um, how good are you, and it's simply so many of the people who learned here, they're really good. They're good. They invested years like that. Like the students who want to go in surgical branches, they spend like 3 years going in operation rooms and learning before they start their training. And you come like a foreigner, and you have to learn the language in the first 2 years, and then you come in the operation room. They have like they're, I don't know how to say that in English, but they're really, they deserve to be at better places because they worked really hard. But there are many foreigners who worked really hard, and there are in the best places like in Hamburg, in Berlin, in München, in Munich. I think it's really
I,
possible,
I would
but
I would
it's
also agree
not
to that because
easy.
where I'm working at present, there also in the neurosurgery department that is full with Ausländers. But not only the assistant Esther, the
Yes,
Facharzt, the Oberarzt, the Gefäßchirurgie branch that is full with Ausländers. So
yeah. Many
uh,
are very successful.
yes, so many places are like that, and yeah, depends on internal medicine naturally. Anesthesia, yes. So
Yes,
all branches are like that, and as you rightly said that okay, it is about how much effort you have taken.
yes,
Initially, couple of years, everybody is depressed. Like 2 3 years, will depressed because you in your country you were like a big shot doctor, or maybe like
yes,
you were understanding, you were very vibrant, you could speak, you could hear, you will not be
yes,
communicating, you will not be
yeah,
understanding, you'll be standing like a dumb person in the corner of the room.
yes. You,
uh,
you have other problems, like one problem that I think everybody has is it's not like it's for everyone who comes to Germany. It's like in Germany for German people and for people who like grew up in Germany. It's not about being nice. I'm sure that in Indian it's like 90% of the time about being nice, about being friendly. In Iraq it's also like,
Mm.
but here it's not about being nice. It's about doing it correct.
Yes,
They
yes.
don't care. They don't care. They don't care if you're like they love you. You're like best friends. But if you don't do it correct, and by correct I mean the way they do it,
Yeah.
it has nothing with like what the world does. It is like the way they do it. Then they'll come to you and they're like really direct, and you think, do they hate me? Like in the beginning was like it was really um it was really hard to accept that, like to go home and think about it. Why did he talk like this to me? But you understand with the time they're like this. It's not about right and wrong. They're like about this, and that's really good because they don't leave anything undone. They
They're
don't
very,
leave
very
anything.
structured and very, very systematic.
Yes,
Everybody, that is what I also like about people. Even see, when I work with people who have come from foreign country and people who have grown here and worked here, I
yes,
find it more convenient to work with the people who have studied here, because
yes,
there you don't have to do a lot of controlling. Okay,
yes,
because things you can assume that things will go proper. In other
yes,
case it is so that if like out of sight is out of mind, if you don't control, the things will be just left like that.
yes.
Okay.
It's really sad, but it's true. Like
Yes, and many
the
times even like,
standards are really high here.
yeah, yeah, that is what. So, this interview or this conversation, I'm just talking to the viewers now that this conversation, we're not trying to downplay our foreign colleagues. We are also from a
No,
foreign
no,
country. We are not trying to downplay. We're just
no.
trying to give a realistic approach, a realistic
Yes,
view. And this was not scripted, so that is, I mean, that is also, it is not like we have decided that okay, we'll sit and we'll talk
no,
bad about some people and good about some people. It's a realistic view
no.
that one should know.
Many are really good. The problem is, I was like, if I compare myself now to myself like before 5 years, I didn't mean bad. I wasn't bad, but I didn't learn as good as people here learn, and that has something to do with time. Like in India or in Iraq, I saw in one night shift, I used to see like 500 patients.
Mm.
Who cares about quality? Nobody cares about
True,
quality.
true.
You just need to work fast.
Very
Nobody
valid
cares about
points.
quality. But here, you don't see 500. You see like maybe 50 or like less. But everyone matters, and
Yes.
they check and they control and they work, and that's a whole nother standard, and you get used to it. It's a new thing for a lot of foreign doctors. It's at the beginning they want to do everything fast, but with the time they learn to do everything good.
Yes, that's a very good, a very valid point that is also to be considered. That okay, it's not, it's about quality. All right. So yeah, we have talked a lot about the system. That was also the aim. That okay, I keep talking to the people. I thought okay, I should invite somebody who is also from a foreign background, has been here for so many years now. So that's very
Thank you.
nice. And before we pack up, I would like to know your suggestions. What would you like to say? Any tips? Anything that you want to tell our viewers or doctors, foreign doctors who think or
Mm,
plan about coming to Germany?
mm. I think at first you must get to know yourself and your goals, what you want to do, where you want to go. If Germany is like the right thing for you, then come to Germany. It's a really nice country. Maybe it's not like the most beautiful country, but for like doctors, it's one of the best, I think. But it's not really easy. But hey, easy things, they're not interesting. Who wants easy things? Easy things are like, they're not interesting.
Correct,
The good
correct.
things are hard things. You're gonna have to work hard. Yes, and ask, like, I think the best advice that I can give is ask the people um, who are really further along the way where you want to, people who have what you want. Ask those
Wonderful.
people, and they're going to tell you.
Wonderful. All right. So, one last thing I want to share with our viewers as well, and I'm going to ask Dr. Mahdi about his YouTube channel. This
Thank you.
AE Way, so
Yes,
erst in
that is
Weiterbildung. Why? Tell us few sentences about it. I mean, what is it? Why do you do it? And what is like? Our viewers will definitely watch it.
Mm.
But I mean, I would like to know a few sentences from you. Why? How? When did
Yes.
that begin?
It began like 2019 in May, and I just really the problem is I what we talked about, that nobody teaches you, nobody tells you to do the right things, and I felt that I wanted to learn, but nobody cared really, and I care about people who want to learn, and I wanted to give them a chance, and I had a small problem where I worked. We had a new guy, and I wanted to teach him, but I didn't have the time, and I felt like those people who didn't help me. I felt like I'm really like them, and I didn't want to do that. So I started to teach what I know in videos because I wanted to give that to people who are like new, so they don't have to go through the mistakes themselves. So they get really they get like they know that there's someone there for them and that they can get better, and that it's not a problem with them. They're not the problem. The problem is um, sometimes it's the system, sometimes it's something else. But if you work on yourself, if you get help, you'll get whatever you want to. And the channel is also in German, and that's one other thing that I discovered. It was really good. That when I talk in German, many people like ask me, "How did you get to be that good in German?"
You were telling about your channel. How? Okay. How did you get so good in German?
Yes, I just people started to ask me, and I think that's one of the most important things that helped me. That I talked a little. I wouldn't say I'm like the best. I wouldn't say that, but I talked a little bit better than others, and that led to the point that people wanted more to help me because that they felt that I wanted to be here. I wanted to learn, and that was very good. And I wanted to say that it's really possible. You can speak German very good.
Yes, I have also seen a couple of your videos. Your German is very, very good, much better than mine.
I don't
So,
think so, but you speak
right,
also really really good German.
right. Okay, then we will conclude here. I hope our viewers will watch your video. For people who are planning for Fachsprachprüfung, people who are planning for to work in Germany, like who are in the process, Bewerbungsprozess, or who have actually begun, are in like first 6 months or 1 year. I would recommend everybody to watch his videos because I have watched them and they are really informative, really practical. You do not have to sit with your five books and read everything. You just yeah, I mean, for deep knowledge, definitely you can. But for
Yeah,
working knowledge, in short, somebody's explaining you, then you definitely watch that. All right, the
yeah.
link to his channel, I'm going to post in description, and you guys can
Thank
watch
you.
it. Do write your comments. What did you think about our views?
Yeah,
If you have any different views than ours, or if you like to correct us on some point, then
yeah,
definitely we'll take that into consideration very humbly. Here, we both have shared our views. That is not a
yes,
generalized statement. What this is what he has experienced and what I have experienced. All right, with
yes,
this, we are going to conclude here.
yes. Thank you. Thanks a lot.
Thank you.